So when you think of a pharmacy, you probably think it looks a little bit like this, right? But there's a lot more detail that comes with it. So today I'm going to take you in a busy hospital pharmacy to follow some real pharmacy technicians. Hi, I'm Dr. Chancellor.
Yep,
I'm Amanda. Nice to meet you. So I'm going to be following you around today. Now, the only thing I really know about a pharmacy is medication, when I go to the doctor or something.
Happy to show you.
Awesome.
All about it.
Let's go. What exactly happens in a pharmacy in the hospital, like a busy hospital at that?
So basically, a physician orders a medication for a patient, a pharmacist checks it to make sure that that's correct, and then we fill it and bring it to the patient.
What is this?
It's where all the medications are.
Okay, so what's happening here?
So these are the carousels, basically.
Okay.
They hold most of the medications that we need for the patients. Doctor sends an order, the pharmacist verifies it, then it comes over here for us to pick. So an order comes up here.
All right.
Then we'll get the label, get the medication, and then we scan it. The pharmacist does the final check, then they'll put it in the bin for wherever it needs to go in the hospital, and then it gets sent up on the round.
Chancellor, we saw where the medication's coming from, but how does it get to where it's going?
Well, for things that they need immediately, like stat, we have this tube system where we can tube it to almost anywhere in the hospital. Just put the medication in the tube, put it in here, and then we click where it needs to go.
Oh, it's so cool. What am I looking at here?
Some medications in the pharmacy, they need to be made in a sterile environment. So we take a lot of efforts to make sure that the room where we make the IV is as clean as possible. Before you can enter over there, you have to put on shoe covers, put on a mask, put on a hairnet.
What happens next? Like, where does it go?
Next, it goes out here for then our techs to deliver onto the floor and so that the patients can get it.
I can tell that you have a lot of training to get to this point. You need to be good with details and numbers, and I'm really impressed by these people, honestly. Okay, so you were a part of Texas Health's Pharmacy Technician Training Program, right?
Mm-hmm.
So can you kind of tell me a little bit about it?
It's a very comprehensive program. It's very abbreviated compared to, going to a college course for it. It's over 8 weeks. It can be a lot to learn in that short amount of time, but I think it was really rewarding.
And you're paid during this whole time?
Mm-hmm.
All right, so what are we learning in this 8 weeks?
As you're doing the modules and you're learning, also you'll have days where you're shadowing full techs and seeing what they do. And then you go back to your modules and you take your tests and things like that.
So what does it take to be successful in this role?
Having an eye for detail, noticing the small things like that, because there's a lot of medications that have pretty similar names, and you have to be able to know, no, I don't need ephedrine, I need epinephrine, things like that. And basic math skills as well is pretty important.
Basic math? So explain basic math skills to me in the setting of a pharmacy technician.
Like addition, subtraction, counting pills, being able to convert from different units of measurement, like from milliliters to units to ounces, things like that.
So tell me what a typical day is like as far as hours.
I work 40 hours a week on 8-hour shifts. And we have a couple different shifts. We have morning shifts, which are 6:30 to 3. Then we have a mid shift, which is 10 to 6:30. And then an evening shift, which is 2:30 to 11. And then we have a night shift, which is 7 to 7, but it's a whole separate team.
Okay, so you're on your feet the whole time?
Not the whole time. I mean, we get breaks, between rounds. We have different rounds we go on at different times, and between those, you get a chance to rest.
Oh, okay. Because I'm glad we're resting now. Cheers. So what are we doing here?
So this is our retail pharmacy. The main focus here is the medications for the patients who are discharging, who are going home.
Is this the place, can I follow along here? Or?
Yeah, sure. Yeah,
okay, awesome. I'm excited.
So this is my coworker, Carissa.
Hi,
she works in the retail pharmacy.
Nice to meet you.
She'll be showing you around. I gotta get back to inpatient, but it was lovely having you.
It was so nice to meet you.
Really,
thank you for everything.
Of course.
Okay, I'll see you again soon.
All right, see you soon.
Okay. Hi. Okay, so what do we have here?
Usually when physicians send prescriptions down, they come over electronically. So once they are processed and verified by the pharmacist, that's when we get to fill the medications. And then you just come and you find the medication, we grab it off the shelf, And then you come over to our little Kirby here. After we fill it, we put it in the bottle. We make sure the label is on the bottle for the patient, and it's with the leaflet. And then it goes to the pharmacist for the final verification step. So that's a little bit about how the retail pharmacy works in a hospital.
I love it. You did great today. Thank you so much, Carissa.
Yeah, of course. Come back anytime.
All right, thanks. That's what it's like to follow in the footsteps of a pharmacy technician. And guys, I've learned a ton today, but I do feel confident that I could work in this role, and I believe you can too.